Hello and welcome. My name is Tim Sunderland. I'm presenter for the Functional Training Institute, and I'm going to take you through a quick presentation, or as quick as I can, on such a complex topic, the shoulder. And what we'll be discussing is why shoulder impingement isn't a real thing. So the term shoulder impingement is just a commonly used condition to describe the rotator cuff tendons where they're being compressed. Okay, while this diagnosis is labeled widely acceptable, it's not an accurate reflection of the underlying mechanisms at play. So within the picture there, that's just showing you what impingement is. It's compression of the acromion and the humeral head undergoing some sort of movement, usually some sort of elevation movement. That's the condition, that's the thing that's going on, that's the blockage, not necessarily the thing that's going wrong. Okay, that's just where we're feeling it, or the point of the shoulder mechanism that's expressing the least movement or handling the most force. Now, if we look at the shoulder and its entirety, it doesn't work in isolation, particularly the rotator cuff, which is where we commonly look for. So it doesn't work in isolation. It's part of a complex, highly integrated system that involves numerous interdependent structures and movements. So when someone presents to us with shoulder impingement, not necessarily and rarely is it solely the rotator cuff's issue. Yes, we may have shoulder rotator cuff imbalances that may occur, and we can definitely strive to amend those imbalances, but we have to look beyond the rotator cuff as to why the rotator cuff muscles are becoming imbalanced. Why are some becoming overused more than others? And it's because the rotator cuff doesn't work independently. It requires all these other factors and structures surrounding it to work in coordination of each other, hence the name complex dance, or a symphony, you might like to describe it. So for the shoulder, the rotator cuff, to have its freedom of movement, to do what it needs to do, we need to look at the scapula, thoracic spine, rib cage, and the clavicle, the collarbone. All these other structures have to work together in a symphony or a complex timed dance for the rotator cuff to move freely and do what it needs to do. So what I'll do is I'll read out this list so you can get a feeling for the complexity or the amount that's going on when we move our shoulders. Okay, so the scapula, it needs protraction, retraction, elevation, depression, anterior and posterior tilts. Now for the scapula to do those jobs, the T-spine needs flexion, extension, and rotation, particularly if it's unilateral movement. For that to work, the rib cage, it needs expansion, something a lot of us, particularly desk-bound like this, really struggle with. We need that rib cage to expand so we can extend the T-spine, retract the shoulders, depress the shoulder blades, whatever we may need. And the collarbone, clavicle, it needs anterior and posterior rotation, it needs elevation, depression, protraction, retraction, aka it needs to be pivoting around the axis of the medial attachment to the sternum. So pretty much the medial attachment's here, clavicle comes out here, and it needs to move around freely, okay? So we need all of these other structures and all those movements that those structures do, they need to be mobile enough to be able to do the movements in full, and almost most importantly is the timing of each of those. If we lack one or more of the mobility requirements or the timing requirements, the rotator cuff will take on that burden, and that's usually how we start getting shoulder impingement syndromes. Okay, so I hope you, after listing that, we start to see a little bit more appreciation of the complex movement that the whole shoulder needs, especially with the ways that we load and move the shoulder. So what we need to do is we need to move beyond strengthening the rotator cuff. We need to move beyond movements like we're seeing in these pictures, where we're doing these external, internal style rotation movements, thinking that the rotator cuff is weak or the rotator cuff is imbalanced. Like I said before, the rotator cuff is just taking on too much, or it's not giving the freedom of movement. Okay, so as personal trainers, we need to stop prescribing these sorts of exercises as a primary focus. I'll say primary focus, because these exercises aren't bad. There's no real bad exercise. It's just who we're giving it to and why we're giving it to that person. It's just they won't help long term anyway. We might get some short term relief, but it's definitely not a long-term fixture, and there is no stretch that will help either. Again, stretching, you may get some temporary relief, but it's not going to help long-term. And often clients will come to us with some sort of shoulder pain or shoulder impingement style symptom, and they'll ask for a stretch, and when they ask for a stretch, it's just because they don't know what else to say. That's it. They just think they're not mobile, they're not flexible, and the only thing they know what to ask is, what stretch can I do? It's not that. What we need to do is we need to focus on movements that improve rib cage expansion. Improving that expansion also accompanies thoracic extension, shoulder blade retraction. Okay. In there I've got a photo of Arnold. He's my man. And then the following photos, I was kind of limited to black and white photos of Arnold because I know his pec flies. He was really big on trying to expand the ribs, thinking that was going to give him bigger pecs. Obviously, we now know that it's not going to give him bigger pecs, but he did have some reason with that, is get that rib cage expansion happening, and then we get a lot of shoulder movement, okay? So the next one I got is we need clavicle movement and scapular depression. Again, I was limited to finding black and white photos of Arnold, but press movements like this definitely help. We're not limited to these movements. There's a plethora of movements and exercises that we can prescribe to help these, but we need clavicle movement and scapular depression. So something like, bench press, we need depression to scapula. Shoulder press like he's doing, you can see clearly that his shoulder blades are depressed down, and that clavicle's getting that movement down into that position. Okay, it's not hunched over and locked in this in. He has to move it back and down and really stretch open that clavicle. And we also need to teach what's usually lacking in the Gen Pop is upward rotation of the scapula. So it's very good, like machine style, high to low rows, any sort of overhead press, even lateral raises, these sorts of things. But we need to find and prescribe movements that complement these sorts of areas, okay? Because we can combine these into like a holistic style program, you might say, for a shoulder. If we're seeking to expand the rib cage, there'll be a flow on of the other movements I described. If we seek clavicle movement and scapular depression, it'll help some other structures that I mentioned before, and definitely upward rotation. If we get strong and coordinated in these movements, usually symptoms of shoulder impingement dissipate because we're getting that symphony, that complex dance of all those structures in good timing and good mobility. Okay. So I like the shoulder joint. It's my most admirable joint because of how complex, how powerful, how mobile, and how well designed it is. But just to limit shoulder impingement to a rotator cuff problem, it's definitely oversimplifies, undermines, and underappreciates the mechanisms of the shoulder joint. So I don't think it's just that. Look beyond that. It's such a much more impressive joint that encompasses so much more around it. So as trainers, we must recognize that the rotator cuff is not acting independently or in isolation of itself, but rather of a highly choreographed system that involves multiple joints and structures in a timely manner. Timing is a big thing you take away from this. So by understanding and addressing the shoulder's complex stance, we can better identify and address the root causes of impingement-related symptoms, leading to more effective and lasting solutions for our clients. So again, I'll wrap it up after this wrap up there. is shoulder impingement isn't rotator cuff problem. That's just where we're feeling it. We've got to look beyond that and get the other structures. Is there clavicle moving? Is there rib cage expanding? Is there thoracic moving? Does the scapula do all its movements in a mobile and a stable fashion? If we can look at these other structures, I guarantee that one or more of those won't be mobile enough or won't be in timing well enough for the shoulder to perform the movements that we're requiring it to move that cause the shoulder impingement. Guys, I really hope this helps. Chuck some comments or questions in below after I post this. I'm definitely keen to have a conversation about this or go deeper into it or talk about specific things that you may want. But until next video, guys, thank you for your time and attention.